Good afternoon, everyone, and welcome. Thank you for joining us today. I think we'll go ahead and get started. Um, Thank you for joining us again for Behind the Curtain, How Dental Advocacy Creates Change. My name is Monica Turner, the Program Manager for Oral Health Kansas, and I will be serving as your facilitator today. We're so glad that you're here. For those of you that were with us for other webinars, welcome back. And if you are new here, thank you for joining. Our goal for the webinar is to share information about the Medicaid program and how everything works from enrollment and credentialing to activities behind the curtain that people are less familiar with, like the legislative budget process and advocacy and why it matters. All of our webinars are or will be posted on our website at pathways-to-oralhealth.org. There's some great information there, so if you miss them, please be sure to check them out. If there are topics about Medicaid that or providing care with individuals with disabilities that you want us to cover in the future, please put them in the chat and we will do our best to cover those topics in future webinars. But for today, our goal for this session is to give you a behind the scene look at effective advocacy and the importance of building relationships with providers, consumers, and legislators. We hope that you will learn how ongoing collaboration with many different organizations is essential to drive meaningful systems change, like the addition of Medicaid adult dental benefits and increasing Medicaid dental rates. But first, I want to thank the KDA for co-sponsoring this webinar. Also, the Pathways Initiative and this webinar is funded by the Kansas Department of Health and Environment, Division of Healthcare Finance, and an ARPA grant. You all will hear from Kevin, KDA's Executive Director, a little bit later in our webinar. A few quick housekeeping items before we begin. Please keep yourself on mute if you're not speaking. Use the chat box for questions or comments during the presentation, and we will try to save time at the end for questions and answers. If we're not able to get to every question live, we will for sure follow up with you. And if you're having any technical problems, please just place that in the chat. There will be a total of 1 CE available for participating today. Please put your name and email address in the chat if you require CEs. Many of you have probably noticed that we did increase the length of our webinar today in order to give you the opportunity to earn a full CE and provide you with more information. The KDA will send out those certificates within a few weeks. And lastly, the recording and slides of this webinar will be available on our website at pathways-to-oralhealth.org. I just want to talk briefly about why we're all here. This webinar is a part of the Oral Health Kansas's Pathways to Oral Health initiative, a multi-stakeholder project. This project focuses on 3 things: support for dental offices and being a successful Medicaid provider, education programs for dental professionals to increase confidence in caring for individuals with disabilities, and lastly, focusing on communication tools like the My Dental Care Passport, a tool we introduced in one of our webinars last year. And like I mentioned, the Pathways Initiative is a multi-stakeholder project. This reflects all those partners involved in efforts to make dental care more accessible and equitable for all. As you'll hear today, the collaboration and partnership efforts are essential in driving systems change. Each of these partners have played an important role in this project. And we are ready to get going on today's agenda. We have a lot to get through. We are going to talk a bit about Oral Health Kansas and who we are, touch on advocacy and why it matters to all of us, get a little social studies lesson from Mary Ann about the legislative process and what it takes to make changes, and how it affects dentists and their teams. And then also show you examples of successful advocacy initiatives and what resources are out there to support you in your advocacy efforts. We will be taking a few polls throughout the webinar, so we would really appreciate your participation. So I just want to briefly introduce who Oral Health Kansas is. I've been with Oral Health Kansas for about 1.5 years now, but often when I introduce myself and tell people who I work for, whether that be someone in the dental field or not, people have often heard of Oral Health Kansas but don't know exactly what we do. So just a bit of history. In 2003, Oral Health Kansas was founded in response to an Oral Health America report card that ranked Kansas as the 5th worst state in the nation for oral health. The goal was to make a difference in the oral health of all Kansans. So even today, Oral Health Kansas is dedicated to promoting the importance of lifelong dental health by shaping policy through advocacy, public awareness, and education. Today, we are going to highlight the nuances of shaping policy, how we are guided by the needs of consumers and providers like you, and the sheer importance of building relationships throughout the state to improve Medicaid and work toward the ultimate goal of health equity. But first, we are interested in knowing how familiar you are with how changes are made to the Medicaid program. So we're going to pause here for just a bit to take a poll. So it looks like based on the poll results, 40% of you are somewhat familiar. So I'm a little slightly surprised by the familiarity with the Medicaid system. I'll say that not that long ago, I was working in private practice and as a practice administrator, and I would have definitely answered, I know bits and pieces. Making changes in the dental office is much simpler. My experience was maybe consulting or collaborating with 1 or 2 key individuals, mainly the doctor, to implement a new policy or have maybe 1 or 2 conversations with the doctor to change fees in the office. I had very little knowledge of the Medicaid system, how it worked, and what it took to facilitate change. For many providers, the Medicaid system can kind of feel like a black box. Things happen, decisions are made, but it's hard to know who's responsible or where your voice fits in. Once you understand how the pieces connect, the system becomes less intimidating, and you can see where your experience can make a difference. And that's really where advocacy begins. Please bear with me. I have another poll question for you. Wow. So it looks like 85% of you said that you do consider yourself an advocate. You all are so much further along than I ever was when I was in working in the dental office. In my 20-year career as a practice administrator, I would have definitely answered no to this question. I saw advocacy as someone else's job, someone that knew more about the process, people in politics, the KDA or the ADA, or whatever professional organization that represented me. But now that I'm more informed, I do know that advocacy isn't just testifying at the Capitol or meeting with lawmakers. It's sharing what you see every day in your practice, the barriers your patients face, the challenges your staff encounters, the solutions that you've discovered. Those real world experiences help shape better policies, better programs. So every denied claim, every patient who struggles to find care, every process that works well or doesn't is information that policymakers and program leaders need to hear. No one understands the realities of providing care better than the people doing it every single day. So we have some great examples of dental providers turned advocate by just sharing their stories and experience. In 2022, Dr. Lisa Thurlow changed the legislators' minds when she testified at the Capitol about the need for adults to have dental coverage in Medicaid. In 2024, Dr. Beatrice Britton was instrumental in restoring fluoride in Abilene, but she had not ever been involved in advocacy before. And then in 2024, again, Dr. Nick Rogers and Dr. John Fales were instrumental in telling legislators about the challenges dental offices have in providing sedation dental care. And then last year, Dr. Jill Jenkins provided game-changing testimony at the Capitol in support of the dental Medicaid rate increase. And luckily, we will be hearing from Dr. Jenkins about her experience a little bit later in our webinar. Now, I would like to pass it on over to Kevin Robertson, the Executive Director of Kansas Dental Association, to tell you a little bit more about our partnership and why sharing your voice matters to every dental practice. Kevin?
Well, thanks, Monica. I appreciate it. It's a privilege to be part of your the webinar today and partner on this webinar. And so that's one of our partnerships that we've had the last few years through Pathways is partnering on these webinars that we've been able to provide to the providers, both hygienists and the dentists, so they can get some CE credit, as well as other people working in the dental offices. But the KDA has had a really good relationship with Oral Health Kansas. As Monica mentioned, Oral Health Kansas started in 2003 as a result of the D that Kansas received on the Oral Health America report card. And I tell you, I think it's really important that we all understand back when that happened and Oral Health Kansas was formed, there wasn't a lot of finger pointing. I mean, Oral Health Kansas wasn't formed and then started pointing at the dentist and laid the blame at their feet, nor did the dentists and through KDA, blame other people with that program. We kind of sat down together and we said, okay, we have this problem. How do we fix it? And so since that time, we've worked very well together to kind of lay out the parameters of things that were low-hanging fruit at first that we thought could help solve the problem. We've had steady increases in gains. The KDA has continued to partner with Oral Health America, or Oral Health Kansas, on several different issues, including, of course, this Pathways project, which includes increasing Medicaid rates and sedation dentistry to create better access for our friends throughout the state, particularly with IDD waivers and the developmentally disabled. Through that time, we've also worked hand in hand on fluoride initiatives around the state, trying to increase fluoride and or stop fluoride from being taken out of water supplies. And I think it's important that we work together because we provide two different um, uh, angles on where we come from. I mean, when we start talking about Medicaid, for example, it's difficult for the KDA with a bunch of dentists, that are accepting Medicaid to ask for increases in Medicaid rates because, frankly, it can be taken sometimes by the legislature that, well, they just want more money. So they just want an increase in those rates so they get more money. But when Oral Health Kansas comes at it and explains to them that, hey, this is an access issue, the fact that there's not enough money in Medicaid and there needs to be an increase in those rates affects how many people are being treated throughout the state. That's where we can work hand in hand. When it comes to a fluoride issue, we can discuss as the dentist can discuss as the expert in the room, so to speak. We can testify about what we see and what it looks like, how fluoride works in the body and whatever. But it really takes those stories from the constituents at home for them to actually, kind of to put those issues over the finish line a lot of times. So we've had a great relationship, as I've said several times already, and I do emphasize that because when I talk to my colleagues around the state, not every dental association has a good relationship with their advocacy organization. A lot of times they're polarized, they're fighting each other on a lot of issues, and they're pointing fingers. And again, I'm proud to say that Oral Health Kansas and the KDA have worked together, and we've held each other's hands and done this together instead of pointing fingers at each other. I hope we can continue to do that. Have other examples, but I know there's going to be lots of other people discuss issues, and I'll turn it back over to Monica.
Thank you, Kevin, for that. I appreciate it. We really, truly do appreciate our partnership with the KDA. Many of the things that we can get done, obviously don't get done in a silo, and you have to have a lot of collaboration and partnership in order to make progress. So thank you. I'm going to actually turn it over to Mary Ann to start talking about recent advocacy successes and the improvements made in Medicaid over the last decade.
Thanks, Monica. So I'm going to run through a little bit of more about advocacy. I do that kind of social studies 101. I can hear the groans from here, but hopefully it will take you back and set the stage and then kind of actually use this year's Medicaid rate advocacy as an example to kind of walk through that process. So advocacy in a nutshell is really just that act or process of supporting a cause or a proposal. But kind of what does that actually look like? So we have an issue and we'll take that low Medicaid dental rates contributing to this Medicaid dental provider network that's not able to meet the demand as our issue. Then we've got a good idea how about raising the rates so they are sustainable for existing providers and can attract new private practice providers to the program to help lessen that strain on the existing network. And then, as you've heard, advocacy kind of comes in all shapes and sizes from, for example, educating a colleague about the new rates or sharing this webinar series with them to speaking to decision makers at your office, to joining the advisory group or to testifying at the state capitol and much more. And all these things can help lead to this desired outcome. And we know that different issues and different outcomes might require differing engagement in these advocacy strategies and types. So if you've joined previous webinars in this series, you might recognize this slide. It's kind of a summary snapshot of the changes in the Medicaid dental program over the past, well, just over a decade. But you might rightly have some questions about, okay, how did we get from where we were in 2013 to now? And some of those questions might be, why did this take over a decade? Why maybe our service is not added to the Medicaid benefit when we need them? Why are Kansas Medicaid dental rates not the same as neighbors in Missouri, Colorado? And how can I make sure that my voice is heard? And that's what we hope to give you that peek behind the curtain today and share ways that you can make sure your voice as a dental professional and as a Kansan is heard. So we've got another poll question here. So what do you think is the biggest reason Medicaid changes take so long? We can take a look at the results, Abby. So a bit of a mixed bag. So the lack of funding is an issue, the legislative process, and that's really what we're going to dig into today. Then bits of kind of a sprinkling of implementation and some honest answers of I honestly don't know. Hopefully by the end of this, we won't have someone in that category. So we're going to play just a short clip here. Again, although this depicts a federal bill, it can start to answer some of these changes, like why can it feel like change moves so slowly?
Marianne, we can't hear it.
Well, we can hum along. I think we all know it.
I know
Sorry, guys.
Kevin's gonna sing this one for you.
I'll
That's
say,
true
I'm
partnership.
just a bill sitting here on Capitol Hill.
And believe it or not, we did practice, make sure that we had this all worked out beforehand. But
You
obviously,
do need to go into your audio and then make sure that you have it selected to allow a video.
Yeah.
Sorry,
Okay.
guys, we apologize for the delay.
Round 2, share sound.
There you go. There we go.
There we go.
You sure gotta climb a lot of steps to get to this Capitol building here in Washington. Well, I wonder who that sad little scrap of paper is.
I'm just a bill. Yes, I'm only a bill. And I'm sitting here on Capitol Hill. Well, it's a long, long journey to the capital city. It's a long, long wait while I'm sitting in committee. But I know I'll be a law someday. At least I hope and pray that I will. But today I am still just a bill.
Gee, Bill, you certainly have a lot of patience and courage.
Well, I got this far. When I started, I wasn't even a bill. I was just an idea. Some folks back home decided they wanted a law passed, so they called their local congressman, and he said, "You're right, there ought to be a law." Then he sat down and wrote me out and introduced me to Congress, and I became a bill. And I'll remain a bill until they decide to make me a law. I'm just a bill. Yes, I'm only a bill. And I got as far as Capitol Hill. Well, now I'm stuck in committee, and I'll sit here and wait while a few key congressmen discuss and debate whether they should let me be a law. I hope and pray that they will. But today I am still just a bill.
listen to those congressmen arguing. Is all that discussion and debate about you?
Yeah, I'm one of the lucky ones. Most bills never even get this far. I hope they decide to report on me favorably, otherwise I may die.
Die?
Yeah, die in committee. Oh, but it looks like I'm going to live. Now I go to the House of Representatives and they vote on me.
If they vote yes, what happens?
Then I go to the Senate and the whole thing starts all over again.
Oh, no.
Oh, yes. I'm just a bill. Yes, I'm only a bill. And if they vote for me on Capitol Hill, well, then I'm off to the White House where I wait in a line with a lot of other bills for the president to sign. And if he signs me, then I'll be alone. I hope and pray that he will. But today I am still just a bill.
You mean even if the whole Congress says you should be a law, the president can still say no?
Yes, that's called a veto. If the president vetoes me, I have to go back to Congress and they vote on me again, and by that time you're so
By that time, it's very unlikely that you become a law. It's not easy to become a law, is it?
No, but how I hope and pray that I will. But today I am still just a bill.
He signed your bill. Now you're a law.
Oh, yes.
So that gives us a bit of an idea, although as I was saying, that's at the federal level, kind of what goes into actually making a change in the Medicaid dental program. So we are going to hear a bit of kind of a host of characters as we walk through how we make these state level legislative changes. So here's a kind of Shakespearean style rundown, but mostly it's here in the slides for you to refer back to. Again, I can see we've got Representative Rivas on the call, so you can make any corrections here if need be. So we've got in the state legislature, we've got their two main chambers. We've got the Senate, that's at 40 members serving 4-year terms, and the House with 125 members serving 2-year terms. And within both are committees which are responsible for all things state budget. And that's the Senate Ways and Means Committee and the House Appropriations Committee. And within these, there are subcommittees which look at healthcare issues. And that's where we are kind of most interested, because that's where we have some of the main budget conversations directly about Medicaid dental. We have the governor, we've got the KDHE, the state agency, particularly interested in the Division of Healthcare Finance, and as you've heard, advocates. And advocates are more than just the advocacy organizations or the lobbyists. The advocates are all of us, the public. We've got the dental providers and patients and their families. So I was touching on this state budget, but why is that so important for the Medicaid dental program? So also known, you might hear it as the appropriations bill or the mega bill. It's that annual budget that directs the public spending for that upcoming fiscal year. And that includes what's spent in the Medicaid dental program. And this state budget must be balanced. In essence, kind of what goes out must not exceed what is already stored and what comes in. The Medicaid dental program dollars come from two main sources. So we've got our state general funds. You'll sometimes hear them be called SGF, and federal funds. So these state general funds are your individual and corporate state taxes, sales tax, etc. And then in Kansas, as a non-expansion state, we follow a traditional federal matching system. So that means that the federal government pays a percentage of the Medicaid program costs, and that's based on the state poverty level. And in Kansas Medicaid, that's approximately around 60%. So a combination of these state general funds and federal funds pays for the Medicaid dental program, and how much is going to be spent is laid out each year in the state budget. However, if we want to change how much is spent, for example, if we want to increase the reimbursement rates, or if we want to add new dental services to the benefit, we need to ask the state legislature to appropriate more money in that state budget for Medicaid dental. So sounds relatively simple. So why has it then taken a decade to get from having a very limited Medicaid dental benefit and a very, very limited adult Medicaid dental benefit in 2013 to where we are now? we actually asked Representative Rivas, who is the only dentist in the legislature, for his thoughts, and he summed it up well. And again, if you do want to add any pieces to your quotes, Dr. Rivas, feel free to jump in. But you summed up well when you said that the legislative process is complex and it takes multiple steps and involves lots of different people along the way. And ultimately, it takes time. It takes time to build these necessary relationships and collaborations to make change. So what we're going to do is take this year's legislative Medicaid rate advocacy as an example to see what goes into making this one change in 1 year happen, and then how you as a member of the Kansas dental community can play a part in continuing to improve the Medicaid dental program. So if the last decade of changes looked complex enough, this is a summary of 1 year, so that 2026 rate increase alone. So we're going to start where we left off the year before. In 2025, as you're likely aware, that there was a $12 million investment in Medicaid dental rates and in sedation dental, and it actually marked the greatest investment in the Medicaid dental program in years. However, what we know is that fell short of what we were asking for and what we needed to raise the rates of all the dental, the fee-for-service rates for all dental services to that near commercial level and to where our neighbours in Missouri are. So we needed to understand more here about, okay, what would we need to make an adequate and sustainable provider network? And we continued to track the data that is coming in and continued to talk with you all. And you told us that these rates continued to be the greatest barrier to accepting Medicaid. But we can't keep this news in this echo chamber. We need to get this to the decision makers. And actually, the timing worked out perfectly with this webinar, because even this morning, Oral Health Kansas and other advocacy organisations were up at the Capitol providing updates and educating the legislature about the current state of the Medicaid dental program, including laying the groundwork that rates will again be a request this upcoming cycle. And education and relationship building is really a multi-year process. As I said, Dr. Rivas is the only dentist in the state legislature, and these are not subject matter experts. You're really the experts in this issue. However, what we have learned is that after years of educating the legislature about this issue, they really have come to better understand the importance of oral health. So developing these relationships with the likes of Oral Health Kansas, the likes of yourselves as dental providers, and consumers in their region on this issue goes a long, long way in how they prioritise oral health. It also gives you and us a chance to understand what those individual legislators prioritise. Remember, they're people too. What speaks to them? Is it the health issue? Maybe they come from a business background. Is it the impact on small businesses and job opportunities? Maybe they come from a disabilities background. Is it how this impacts the disabilities community? So once you've done that kind of educating and laying the groundwork, in the new year, the legislative session begins, and that's when this good idea, so the good idea this year in 2026 was appropriating more dollars to increase the Medicaid dental rates, was brought to these relevant budget subcommittees. Remember back when we were talking about the players, we need to bring it to the subcommittees of the Senate and the subcommittees in the House. And this request is presented alongside the why. And that emphasis of why can be tailored based on these priorities you've learned about the members of the committee. So we at Oral Health Kansas, the KDA, other advocacy organisations, families and patients and dental providers asked for the funds to finish the job, so to speak, on the Medicaid rates and raise them further. However, even if the legislators in the budget committees see the value in the Medicaid dental program, you need to remember the budget is finite. It's a limited resource. And our ask then needs to compete against lots of other asks and requests, yes, in healthcare, but as we then go to the budget, the kind of full chamber budget committees, against things like education and infrastructure and more. And remember, this budget must be balanced. And in this past year and this coming year, there's also an overall aim to cut spending. So this year there was a bit of a split decision between the House and the Senate. The House Budget Committee put $15 million all funds, so that's, remember, those state general funds plus the federal match into their budget to take to their full House chamber. But the Senate decided at that stage not to include any dollars to take to their chamber. Then each chamber votes on their respective budgets. Once they've each chamber has voted, they must settle their differences. So as we saw last year, there was a difference between what was the House had wanted to put in their budget and what the Senate had wanted to put in their budget with relation to Medicaid dental. So both sides meet, make final decisions on what to keep and what to cut, and then it was settled that around $5 million, all funds would be included in the state legislature's budget. So a whirlwind, to say the least. However, it really is a testament to the years of work you and lots of others have kind of put into the Medicaid dental program, and the fact that the legislatures, who, as we're saying, are not dental experts, and in a year where cutting spending was the aim, elected to support you as dental providers and your patients it was a huge step. But where do dental providers come in, and what can you do? So when we're identifying and understanding the issue and laying the groundwork, this is a really critical and ongoing step. And you as dental providers and your patients are really critical here. And as Monica mentioned earlier, no one understands the day-to-day reality of dental practice better than you. So sharing your story and experiences, what is working well, what isn't, and what is that issue? Why is this issue happening, and what changes would help overcome it? And you can share it in many different ways. We'll give you some more information about how you can share your story and experiences. One of the places is the Dental Medicaid Facilitator Team, which is part of the Pathways project run by Oral Health Kansas. And also you could share in an advisory group, the Dental Provider Advisory Group. Another thing that can be useful is that relationship building process. Who are your representatives? Do you know if any of them sit on any of these particularly relevant committees? And you'll get these slides, and it has a link here to find the folks that represent you. So as we were saying, in the new year, that's when the budget decisions really heats up and the House and Senate subcommittees meet, and it has that opportunity for public testimony. And I really like this quote here from Representative Rivas. The most effective testimony, and was really highlighting that it's delivered by a broad range of constituents, not solely by lobbyists. It's really highlighting that your voice and your patient's voice really, really matters. Grassroots are impactful for the advocacy of proposed legislation. The legislators, they serve Kansans, and you as Kansas dental professionals do carry a lot of weight in this setting. And in fact, as we were saying, much more than advocacy organizations and lobbyists alone. And over the past several years, your patients and their families have advocated in great numbers for the Medicaid dental program. I can see a few people on this call. Shout out to patients and family advocates. And then in last year in particular, we saw increased engagement from dental professionals, and it made a really great impact. And Dr. Jill Jenkins, who testified at the Capitol earlier this year, is here. And I'm going to invite her just to share a little bit about her experience of what it's like advocating for the Medicaid dental increase at that state level. So I'll pass it to you, Jill.
Thank you. That was a really great summary of the process. I'm going to be honest, my entry into kind of advocating for Medicaid, I've been a Medicaid provider forever, but I really had no idea that I had the ability to affect change until I started getting involved with the Kansas Dental Association and understanding how the legislative process worked. I mean, I'd never been to the Capitol. I mean, maybe in like 5th grade for a field trip, but that's not something that was relevant to my life. But through learning that there were different dental things that were involved in the legislature, I realized that, there's a lot that we do to talk about, and, often complain and grumble about. But there are real ways that we can make impact. And I think initially it was just being aware, noticing that there were things that we could do. And then I think simply someone asked, will you write a letter in regard to this? And I will say last year, the letter writing to legislatures was awesome. And there were so many people that I'd never heard from in the dental community that were really advocating and writing letters, and that's awesome. And then after that, getting a little bit more aware with the process and getting a little bit more involved, and asking a few more questions and just being curious. Why are these things not happening? Why are these changes moving so slowly? What do we need to do? And then learning to figure out how to communicate, rather taking the letter writing skills into being able to verbally communicate. And I think it was really impactful what Marianne said, that, as dental providers, we are business owners and small business owners very often, and that carries a lot of impact. We employ people in our businesses, and we're caring for a community of patients that we're choosing to care for. And so being able to formulate how we approach different requests from that angle as providers and business owners, I thought really was a big impact last year.
Thanks, Dr. Jenkins. And yeah, it was huge. And that was kind of touching on that point earlier of the importance of getting to know the legislators. Again, we were saying they're people too and have different backgrounds and different interests. And I think pairing some of these points all worked really well. The health impact, the impact you all have as employers, the impact you all have as small business owners. And I want to echo what Dr. Jenkins said as well. The engagement this year from dentists was really one of the big difference makers. We had lots of letters, that written testimony. So again, that's an opportunity. And then that verbal testimony, which makes a huge impact at these committee hearings. So as that budget is passed back and forth between these committees and these chambers, like we discussed, that's when we kind of listen to our lobbyists. There come some of those advocacy experts. When should we stay quiet and when should we push? So this is where signing on to some of the weekly updates and joining the advocacy coalition can be a big help. Should I email my representative right now? Which representatives are really vital to reach out to in this moment? For example, this year, as we saw, the Senate initially decided not to include any additional dollars for the rate increase in their budget. And then we knew when the time came that we needed to reach out to the members of the Senate Conference Committee, who makes the decision when they're rectifying those differences between the House and the Senate budgets. We needed to reach out to them at that moment about just how important this is for the Medicaid dental program, for Kansas dentists and small businesses, and for the health of Kansans. So it's that little bit of when to reach out and when not to. And actually, a story from the year before was the representative was talking about the number of emails that they got at one time on this issue, and how that really was a difference maker. When they hear from a few different people in their constituency about the same issue, they know it's a big deal. So again, us coordinating and helping have that coordinated push can really, really make a difference. So we're going to get to the end. The Medicaid rate increase was signed into the budget this year, but now it's kind of time to implement. And then this year, many of you shared with us what your priorities for the rate increase were via the survey that was sent out earlier this year. Because as you know, even though there was another rate increase, it's again not enough to increase every single rate on every single code, but increasing the rate on service and certain service types could make the biggest impact. all that information has now been shared with KDHE and the Medicaid agency, and they're actually, as we speak, using your priorities to make the final changes in those rates, which are hopefully going into effect this coming fall. And when fall comes around and those rates are implemented, again, you can use your voice to be an advocate. For example, spreading the word about the rate changes with your peers and engaging other dentists across the state. So in a nutshell, this legislative process is complex, it's lengthy, it takes a bit of patience, a lot of educating, relationship building, but as you can see, positive change is possible. There's a huge difference between the Medicaid program in 2013 and where it is now. And that's because of people like you in the dental community, your patients and their providers, paired with the advocacy organizations and lobbyists making these kind of collaborated and coordinated pushes for change. You're not alone in doing this. We're here, the KDA is here, and many others are here to support you in your advocacy in whatever way your advocacy looks like to you. So we're going to do another poll here, and then I'll pass back to Monica. So what Medicaid challenge has affected your practice the most? Thanks, everyone. And I think time for the answer reveal. Yeah, and again, mixed bag here, but it looks like the majority is still speaking on to the low reimbursement rates, which is again a preview of what we're kind of going to ask for again this coming cycle. Claims and billing issues, and I think that would be one. Actually, Monica will touch on the Medicaid Dental Facilitator program a little bit on this as well. And yes, it can still see some of those issues with the enrollment process, and for finding reliable information, sometimes that communication between the parties of KDHE, providers, the MCOs comes up, and staffing issues. And Monica, I'll pass back to you.
Thank you, Marianne. Like Marianne said, I'm going to kind of not rush through this, but go through this kind of quickly because I do want to leave enough time for questions. We want you to know that you're not alone. We understand, albeit from a different perspective, that working through Medicaid challenges can be time consuming and sometimes very frustrating. If you have recurring issues that you, or if you just need troubleshooting, we want to know about them. We won't always have the answers right away, but we will do our best to investigate them, keep you informed about what we find. And I like to think that Oral Health Kansas team is pretty well connected. We can submit these issues to our you can submit these issues to our dental Medicaid facilitator team. That can be found on pathways-to-oralhealth.org. And the email address is just info@oralhealthkansas.org. We also have lots of other resources on the Pathways to Oral Health website, provider guidance documents, recordings of our last Medicaid webinars, and links to educational programming for providers wanting to learn more about caring for individuals with disabilities. And if we've sparked your interest at all in legislative advocacy today and you need more information, please look for our advocacy toolkit on oralhealthkansas.org. You'll find a printable toolkit as well as 6 accompanying videos. And each will just kind of tell you the journey of the bill. It's a little bit of a summary of what we've done today, legislative timeline, which after our webinar today, you see how important it is to have that coordinated push So the legislative timeline and how to develop your talking points when you're talking with legislators. We aren't, if we aren't taking action to educate our policymakers, these decisions will be made for us by someone. It's up to us to stand up and have a say. So here are some other great ways that you can get involved to help improve oral health policy in Kansas. Like I said, I want to try to leave time for questions, so I'm not going to go through each one of them. But signing up for our weekly Wednesday update, if you're not already signed up, is a great way to just stay informed. Everything that's happening at the legislative level that has to do with oral health will be published here in this update, as well as opportunities to sign up for provider advisory group, join the advocacy coalition, and then also, in addition to signing up for those things, sharing your experience and verbal and written testimony, and then all about contacting your representatives and reporting your Medicaid challenges. Those are all great ways to get involved. So we actually are going to pause here and answer any questions that might have come through on the chat throughout the webinar. Or if you would like to come off mute and ask your question, now is your opportunity to do that.
Monica, we have one in the chat.
Okay.
And Abby did kind of respond to it. But the question is, do you have information I can share with families as a home visitor? And Abby shared the Consumer Advocacy Toolkit link, but if you wanted to talk a little bit more.
Sure, that consumer advocacy tool link is found on our oralhealthkansas.org website. That is the screenshot. Marianne, do you mind going back to that screen, to that slide? Sorry. It's the one with the red. And it is, yep, that is the Oral Health Advocacy Toolkit. And it has some great information in there about like those videos. It talks about the legislative timeline. It gives some great ways to develop your talking points when talking with legislators. This is a great resource to look at whenever you're trying to share, or if you're wanting to share with your family members.
I'd also add on the Pathways to Oral Health.org website, there is a section of educational resource for families, patients and families. So that can kind of give that perspective from the patient's side. So there might be some great resources in there as well that might be useful to share with your families as a home visitor.
Yeah, and the one I sent in the chat is a consumer's toolkit to basically do just that, is advocate to your dentist and legislators about how to become Medicaid providers, why it's important. And then on top of that, to also see individuals with disabilities. So it's kind of just breaks down and makes it really simple. It gives you examples of like a phone script of what you can say, emails you can write, Facebook posts you can make, just kind of really writes it all out for you. So it gives you a good starting point for everything.
Thank you guys for that. I think I misunderstood the question. So any other questions out there that we can answer?
There's one more question in the chat. What are the considerations between advocating for a particular dollar amount increased, example, $15 million, versus advocating for fees being set at a consistent percentage of UCR that will increase as UCR increase?
Ooh, that is a tough question. I think that it all has to fit within the budget, no matter whether it's a percentage increase or a dollar amount increase. Mary Ann, do you have any thoughts on that one?
Yeah, and I'm gonna also turn to if Tanya is still on the call, or Rip Revis to.
Yeah, I can jump in on that one if you want. So I've just been there 2 years, but I can tell you right now, if you try to do a percentage increase on a like plan for like the next 10 years, it's going to be X percent per year. That will not even get anywhere. Every year it's going to be the battle of the dollar, and it's hard enough to explain to some legislators a lot of this stuff financially, let alone throw a percentage increase in. And I just don't think it's going to be tough. I don't think we can pass things too that hold the future legislature budget captive to those increases. That may be a question for Kevin. He's been around longer than I have, but I think
no, you're right, Dr. Rivas. The current legislature cannot bind any future legislators with funding, so it's something they have to do year after year. Now they could have a gentleman's agreement, that hey, with the pay for the next couple of years, we're going to try to increase something, but they still have to go through the process.
Thank you, Senator Rivas and Kevin, for those thoughts on that. So it sounds like it's an annual thing that has to be passed through the legislature. Hence, again, why it does seem like everything takes so long, because you do have to start the process over annually.
Yeah, I guess I would add this, if you don't mind, Monica, about the funding.
Sure.
I know we're getting right up to our time and people want to get off, but the budget process has changed a little bit. So, for example, next week we have a meeting with Department of Health and Environment to talk about what our funding, all the advocate groups, not just KDA and Oral Health Kansas, about what our funding thoughts are and funding requests are. So we're going to ask them to put additional money into their budget request, so that so hopefully, we'll start off with a higher number, right? So we don't have to keep asking for more even after the governor or the legislature, puts in their legislative budget. But that hasn't been the case lately, so we have to keep asking for more. They pretty much have started from last year's baseline, and then if anybody wants increases in any of the agencies, they have to go and kind of get in line, if you will. So that's kind of the way that's gone.
Thank you, Kevin, for that additional information. We are out of time. If you have put another question in the chat, we will try to address that offline. We really do appreciate your attendance today. Please, we have lots of resources. This video or this webinar will be posted on our website at pathwaystooralhealth.org. Some of the slides that we didn't get to that do have our references on there, please feel free to look at those online. Give us a week or two to get that uploaded. And then please join us again on October 13th for our next webinar. We'll probably have some information about the new Medicaid dental rates. They should be going into effect this fall, and how those dollars have been allocated. But for now, goodbye, and thank you so much for being with us today. We really appreciate you.